Erlanger Hospital says it has a response to local and national trends of violence in hospitals. Thanks for joining us. I'm Kim Chapman-Whitfield.
And I'm Josh Rowe. Erlanger says they will give all their employees their own personal panic alarm. Hospital says employees will have this alarm on them while they are at work. When something does happen, that alarm will put out a sound that all employees will recognize.
The alarm does not contact police or other law enforcement. Instead, the noise is a signal to employees to contact hospital security.
News Channel 9's Mary Beth Mangrum leads us off tonight with what trends of workplace violence have led to this change.
According to the U.S. Bureau of Labor Statistics, healthcare experienced one of the highest incidence rates for workplace violence of any private industry sector from 2021 to 2022. Now, Erlanger is working to prevent that national trend from affecting their staff by using this new device to sound the alarm.
It's not fancy, it's not IT designed, it's just a method to bring attention to me if I feel unsafe.
For the staff here, Erlanger is introducing a simple trigger, hoping to curb a bigger problem.
Healthcare workers are 5 times more likely than any other industry to actually be victims of workplace violence.
When we asked how many workplace violence incidents Erlanger sees per year, a spokesperson told us, if we must answer specifically about Erlanger, like other healthcare organizations, we consistently have around 17 reports of WPV in various forms and severity since the beginning of COVID. They also said since the COVID-19 pandemic, that trend has not decreased. On the national scale, the American Organization for Nursing Leadership tells us this trend ramped up during COVID-19 and attributes the workplace violence in hospitals as a reflection of society.
Both OSHA and CMS say employees have the right to work in a safe environment. This is part of our efforts to make them feel safe in their environment.
According to a survey done by National Nurses United in 2023, nearly half of nurses reported an increase in WPV in the previous year.
The device itself was picked based on something I can take with me anywhere.
This alarm doesn't alert Erlanger's security team or law enforcement when something happens. Instead, the goal is to draw the attention of other staff or bystanders.
Attach it to a pocket, attach it to something stationary so that when I pull it, then it will make noise and everybody knows to come to my rescue.
In Chattanooga, Mary Beth Mangrum, News Channel 9.
Now, we reached out to other hospitals in our area to see if they plan to implement a similar security measure. CHI Memorial tells us they have recently implemented a number of significant upgrades to their security, but they can't disclose specifics due to safety.